Hey y'all, I'm Megan,
And I'm Jalen.
and this is our journal club on children with ADHD and treating them with vitamin D3 and neurofeedback therapy. So we're going to start with the overview, and Jalen's going to discuss that with you.
Okay, as Megan mentioned, the Journal Club is on ADHD and vitamin D. This study was conducted at University of Medical Sciences in Iran, and all of the main authors worked at this research center in Iran at the University of Medical Sciences. It was a double-blinded randomized control trial, and the hypothesis was that improvement of vitamin D in ADHD patients might affect the features of the disease. So now I'm gonna go over the background. First, I'm gonna tell you ADHD, hyperactive disorder, is a neurodevelopmental disease that is accompanied with EEG patterns and low levels of vitamin D.
So when the EEG patterns is kind of be very important when you're going to talk about the results of the experiment. So what I want you to keep in mind is that EEG is elevated power of slow waves in the brain, are also known as theta, which is what we're going to refer to them later in the presentation. And decreased power of fast waves, also known as beta, right? So we're decreasing the power of our fast waves in our brain, also known as beta, and we're decreasing and we're elevating the power of slow waves in our brain, also known as theta. So keep that in mind when we go to talk about it later in the lecture.
Okay, so I did look up a trial that was done in 2012 that was similar to this trial. It was called the relationship between serum vitamin D levels and attention deficit hyperactive disorder. Okay, it was a case control study, and it was done between children that are between the ages of 6 and 12. They had 37 children with ADHD and 37 children without ADHD. They drew blood from them to determine the serum levels of vitamin D, and then they discovered that the serum level of vitamin D was significantly lower in children with ADHD. So this trial was done to investigate the effects of vitamin D supplementation and neurofeedback on children with ADHD.
So the people that were selected in the trial were between the ages were 42 qualified children, right? So 42 of the children qualified with the inclusion factors that they wanted. 25 of them were boys and 10 of them were girls. They were between the ages of 7 to 13, and their IQ had to be above 80. Now we're going to go more into this when we're talking about the inclusion factors next. Go.
Okay, so as you mentioned a little while ago, you had to be between the ages of 7 and 13 years old. You had to live in EST?
Yes, I ran.
Yes, Iran. And you had to have an IQ above 80 with an increased theta above 7 hertz and a decreased beta wave below 13 hertz. You also had to have a diagnosis for ADHD done by a psychiatrist, and that was based on the DSM-5 criteria for ADHD and the QEEG. You had to be referred to them by
Imam Hosen,
counseling and psychological center in Iran. Okay. So for the DSM-5 criteria of ADHD, you had to have 5 or more symptoms, or you had to have, it was 5 or more symptoms of inattention, or you had to have hyperactivity for 6 or more months, to a degree that negatively impacted your academic or daily activities. Okay, so now we're going to talk about the exclusion criteria. You could not participate in this if you had another neurological or medical disorder. If you were on ADHD medications within the last year, you were premature at birth, your parents smoked or did any drugs at the time of your birth, if you are on a special diet within the last year, or if you're using multivitamins for more than twice a month in the last 6 months.
So this in the study, remember that we're separated into two groups. We're separated into a control and we're separated into our experimental groups. So this was done on a 1-to-1 ratio, right? And they were separated into two groups of 21, just like we said before, because we had a total of 42 participants that qualified for this experiment. And this experiment was done over 8 weeks. So a very short period of time, which we will discuss more later in the video. But the intervention group received 1 vitamin D3 capsule, which was about 1,500 IU once every week. I'm sorry, 50,000. I said it wrong. I'm my bad. And the control group received 1,000 milligram olive oil once every week. So this was done once a week, right? They're not taking these D3s and olive oils more than once a week. So pretty easy form of adherence for the patients in the trial, which kind of helps not skew the data that's going to be given from it. So they were prepared by, both of these capsules were prepared in the similar shapes and forms and colors, so the experimental and the control group couldn't tell if they were in the experimental or the control group. And this was done by Zaharvi, a pharmaceutical company, and Heron, Iran. So the placebo capsules have the same shape and color, as I said before, as the D3. And when they were doing this experiment, so in order to do the neuro feedback mechanism, a part of this experiment, because that was also part of their treatment plan, the parents had to bring their child back once every week and to get the treatment done. So they both of the groups went under 10 sessions of daily neurofeedback based on distorted brainwave patterns. Participants' physical activity was also measured during this time, and they tried to tell them to limit it so there wouldn't be as much variability, because sometimes when you do physical activity, it can mess with the levels within your brain. And distort the brain patterns, of course, right? Because that's what we're focusing on, is the brain patterns within the kid's brain. We asked them to avoid any changes also in their dietary habits and have fewer exposures to sunlight due to what they're on, right? It's vitamin D3. D3 is also known as the sunshine vitamin, right? So it's a good thing that we want to get them to stay out of there, because it can cause them to either have higher or lower levels of D3, most likely higher though. Randomization was conducted during this. It was done by a computer-rated generated system, and also a physician computed the randomization for the subjects. Also, I forgot to say that, so after 10 to 20 hours of fasting, venous blood samples, about 5 cc's, were taken from each child. And this was done at the entry and at the end of the trial, just to measure their serum levels of vitamin D3, because that is one of our ways that we are going to be seeing how well this is working within the experiment. So the outcomes and how these outcomes were measured. So the primary outcomes were measured between the two different groups by the independent t-test or analysis of covariance, meaning that this means that we had factors other than the independent variable affecting the dependent variable. So just different things, mainly like I said before, the sunshine, the amount of physical activity that these children are doing. And those were just different things that could be affecting our data, but hopefully they're just minute, so the data is still okay. The data categories that we used in the experiment were separated into two, right? We're going to be measuring our serum parameters of D3 within these children, and the electroencephalography, which is measuring those alpha and theta waves within their brain. All right, so now we're going to talk about the results from the trial that our paper was talking about. So pretty much when they did the trial and they selected the children, right, and they separated them into groups, they made sure that their age, their weight, their height, and their gender was pretty much evenly distributed throughout both groups. And it came out to be that there was no big significant difference between the two groups. So that's a good thing, meaning that it was evenly distributed, mostly due to the 1-to-1 ratio that it was being distributed by. There was a chart within the paper that talked about this and showed the significant values of this, and that is where the information came from. So what were the results of the study? So the results of the study was that pretty much if you were to give a child with ADHD vitamin D3 with neurofeedback therapy, they can see a positive outcomes in the relief of like some symptoms over the control group that just received olive oil. So pretty much what it was doing is that it helped the child pretty much focus better and have a better academic success. And so these groups were kind of compared differently. So remember that we had two different groups of like values we were comparing. We were comparing our serum concentration values, and we were we were comparing our electroencephalography features. So in our encephalography features, we kind of compared the relative power values and the relative power ratios. And then we kind of also went off the Connor system where we compared those power ratios that we got. Now there is a chart within the within it, where I am going to show you. Let's see if I can get it up. Share your screen. Here we go. Okay, so we're gonna click on here. I really hope y'all can see this. Okay, so what we're showing here is that this is our serum parameters, right? And in these serum parameters, you can see that there's no statistical difference between the theta and the alpha groups. Now, this is because our p-value is 0.08 with this, and that means it has no significant difference, right? If our p-value is less than 0.05, we have no statistical power or difference, whatever it's called. And so then we're going to go into, and this is, I am so sorry, y'all. My bad. And keep in mind that chart that I just talked about was after the intervention. Okay. Okay. So now I only mentioned that because this next chart I'm going to tell you about is before the intervention. I just realized, y'all, I am so sorry. I had the wrong chart pulled up, but this chart I'm showing you now is the one I was just talking about, how there is no statistical difference between the theta and the alpha groups. So I'm so sorry, but this is the right chart now. My bad. Well, as I said before, there was no difference between the serum values and the serum value concentrations. And that just means that the same thing I just said about the p-values, but that's different. The p-values are very different in the intervention, before the intervention, when we compared the encephalography features. So as I just said, I talked about it before, and then we're going to get to our next slide. So now we're going to talk about after the intervention, right? So remember that we're comparing the alpha and the theta beta and theta alpha brain waves within the control group and in the experimental group. So between the control and the experimental group, the theta relative power is, all right, now we are back. Okay, so sorry for the inconvenience. And anyways, so we're still talking about these theta, these alpha waves, these theta beta waves, and the theta alpha waves. So remember that I just said about those theta waves in the experimental compared to the control are less than, right? The control had greater theta waves than the experimental. But when you compare the theta and the alpha waves together, so as we can see right in here in the chart, I don't know if y'all can see my cursor, but that's what I'm pointing to. And there's no significant difference. So there was really no significant difference between the theta and the alpha waves between the experimental and the control group. But there was a difference when we compared the theta, just the theta waves. So right over here in this side of the chart, the theta waves by themselves. So I'm going to stop sharing and we're going to continue on. So now what we're going to do is, I'm so sorry, y'all. I'm trying to get all my screens in order right now. So now that we talked about that, there was really no statistical interpretations of the data that were really reported besides like the p-value and using test statistics from what we could tell. So that was a pretty interesting part of the data that we found. And there was no major side effects found from the experiment either. Because, I mean, you're just dealing with pretty much vitamin D3 and olive oil, which you can overdose on and have bad side effects, but most of the time it's not really going to happen. So now what we're going to do is we are going to talk about our author's conclusion. So the author's conclusion is that when comparing these studies to other studies, it helped prove that the results were correct, right? That there was a difference in the children that were given the D3 vitamin and neurofeedback therapy, because they were able to see an improvement in their child's ADHD symptoms. The authors do accurately portray the results, right? So what they're saying in their conclusion was really spot on with the results of the article and the experiment. The author did say, though, one of the main limitations of this trial was that it was only 8 weeks long. And personally, I know me, I have ADHD. And if you are only on medication for 8 weeks, sometimes you can tell if it's working, but other times you need to take it for a good while to actually see it make a difference within, because you don't really realize the difference until like a month or two after. Or at least I didn't when I was little, when I first started taking it. So in future experiments, it may be done again, but for a longer period of time, right? And maybe they in this experiment, they looked at all different types of ADHD, so anti-attentiveness, hyperactivity, impulsivity, and distraction. So rather than just looking at all of them, maybe we should just focus on like the different sections of it, because everyone has different ADHDs. Another thing to add in for this is that they didn't look at the polymorphism of the proteins where the D3 is binding to in the body. So that could be a different factor that could be affecting the efficacy of the D3 vitamin within these children. And like the other thing that remains unknown is exactly the right dosage of D3 given to children, right? So they were kind of just doing a shot in the dark about where they think the vitamin D3 should be, and also by going off of other experiments that were done, like we talked about in earlier on. So all in all, what I think is that there's a lot of strengths to this trial, because there was really no biasness from what I could see, like what we could see. And because the drug companies didn't do the dosing or anything, they just made the drug, and the school where the professors were the ones that sponsored the trial, but the professors were not the ones that sponsored the trial. So that decreases the biasness from there. But one weakness that I noticed was the way that they split up the groups. Even though there was no significant difference between the groups, I think that they were not split up evenly enough. Everyone is different when it comes to ADHD, and I feel like a big factor into this is that they had more boys than girls. So if they were to do another experiment, maybe they should do a group of girls and then a group of boys, because ADHD shows up in girls differently than it does boys. So that is a huge factor that I feel like wasn't taken into consideration when doing this. And I agree with the conclusion of the author that the D3 vitamin was a good comparison, or not good comparison, but can be effective at achieving primarily good symptom reliever of ADHD. But I feel that the benefit weighs out the risk, due to the fact that if the patient wants to try a more holistic route to treat ADHD instead of the medicine route, this could be a good place to start. These patients are also similar to ones in my community, just due to most people get diagnosed with ADHD around this age range, so that I know of, because that was actually the age range that I was personally diagnosed with ADHD. I don't think it would be necessary to change your opinion upon if, let's just say, Vyvanse is better than using the D3 vitamin with the neuropathotherapy, because there needs to be more research done, right? And if they're going to see if this is actually as effective as a medication, or just as could be an effective route for people with ADHD, then they would need to do a comparison test between the drug and the usage of D3 in children of this age range. So I feel like that what they could do is you would keep this information in your back pocket. And if you have a patient come in that wants a more holistic route of treating their child's ADHD, or they're complaining of their child and they think they have ADHD, but they don't necessarily hit all the marks to be diagnosed with ADHD, this may be a way to say, hey, give your child a D3 vitamin, see if that helps, because it may regulate their brain better. But that's all that we have for today. And I hope you all enjoyed our video. Thank you. Bye. Oh, also before our what's the name?
University of Medical Sciences.
Yes, the university.
That's who it was funded by.
Yes, the University of Medical Sciences is the one that funded it. So awesome, y'all. Thank you so much, and I hope you have a great day.